Welcome to the Galen 15.1 Upgrade webcast. We're going to go ahead and get started, but just a note before we do, all of the questions that are generated from this webcast will be posted to the Galen Wiki along with screenshots of the updates and configuration steps for the new enhancements. Your presenters today will be Catherine Hallowell. Catherine has over 20 years of experience in healthcare. She's been part of EHR implementations, practice management system implementations, practice workflow analysis, and management of after-hour clinics. And myself, Ellen Thomas, I'm a Galen clinical consultant with 20 years of healthcare experience, 7 of those being with the Allscripts software. Our agenda today will be an overview of the updates to the V11 note. The 15.1 upgrade itself became available on December 4th, and it includes hundreds of enhancements, many of them long awaited. Allscripts did a really good job listening to user groups and Client Connect with the intent to update the look with a consistent design, increased patient safety, user satisfaction, and to improve administrative function. But in today's webcast, we're going to concentrate on the changes and enhancements to the V11 note and the note admin sections of TouchWorks. Afterwards, we're going to go to the application and actually do demonstrations of the functionality and the configuration where it applies to recommended orders and required items, note output progress checks, text macros, and text templates. The majority of this webcast will be conducted within the application, but we will provide the slides and the configuration steps for your future reference. Catherine, if you want to go ahead and switch over to the application. We'll go ahead and get started. Okay, we are in the system, and you can see right off the bat that they have come up with a new color palette that's brighter and easier to view, and they have added quite a few new icons. I'm going to switch over to the clinical desktop quickly, and before I do that, I'm going to switch to Allison. And go to the clinical desktop. You can see that they have a lot of new icons. In addition to new icons, they have recolored and reformatted the icons that they've used in the past. When we look at, let's see, where is my chart viewer? When we look at the chart viewer, you can see that they have additional new icons here in the chart viewer. We have a sign note. This indicates that a note has not been signed yet, a finalized note indicated with this icon. And you can see an additional new icons down here, the new color format with the icons indicating that these need attention, they're red. And then also there's a scanned document. We've given you a comprehensive list of all of these icon changes in the slide deck, but we want to concentrate, as I said, on the note. So this is the new note icon, and the functionality of this icon really hasn't changed. We click on it, and we're going to go ahead and open a new note and take a look at some of the new icons within the note. So this is the note authoring workspace. And you can see right at the top, along with the changes in color, there are 3 new icons here at the top. And the first icon that I want to take a look at is Add Form Top. We've always been able to add a form to any section of the note. But now, instead of having to right-click and scroll and search for the option that you want, you simply highlight where you want to insert a note form and click on the icon. And that opens the form selector box, and they've made some changes here in this section. You can see now that these stars indicate favorites, and you have the ability to create favorites within your form selector. So if your providers consistently use the same note forms over and over again, they can create their favorites. And in addition to creating a favorite simply by clicking and unclicking on the star, they can sort by favorites. So they've added a My Favorites to this filter in this form selector box. In addition to adding it to the list, they've given us the ability to create this as a default. And I'll show you where we're going to make that your default when we talk about preferences. But it's a simple preference setting that sets this as My Favorites. We're going to go ahead and cancel out of this and talk about the next icon. This icon is Add Image Top. Again, not a change in functionality. We've always been able to add an image, but it's a simple click of an icon. Once you indicate where in the table of contents you want to add that add an image, you click on the icon, and again, you can still import an image. You can do patient-specific images. So if we say that in the physical exam, they did a more extensive exam of the arm, he wanted an image inserted, it automatically puts that image in the top of the history of present, well, it put it in history of present illness, that's fine, wherever you indicated that it wanted to go. The last icon up here is Add Text Template Above. And this is new, the ability to add a text template anywhere in the note form. Previously, you had to pre-build those text template items into a section so that you could pull those in. Now, if you want to add a text template in social history, highlight that area, click on the text template, and it pulls a text template area right into that section of the note. And you can do that to any section, giving you the ability to free text or pull in a specific text template. Catherine will be examining more about the text template and explaining how to create text templates for specialty and where also other places that you can use text templates in the system. So these three icons we've talked about. Over on the far side, on the right side, there's three additional icons. This is another new icon, and this is probably, in my opinion, one of the more exciting additions to 15.1 is a macro. With 15.1, we've been given the ability to create and use personal macros in any free text area of the note, as well as on the clinical desktop and the task details. Catherine is going to go more into creating personal text macros, creating enterprise text macros, and where those macros can be used in the EHR. So we're going to come back to this, but just letting you know that this is a macros icon, and then we'll go forward with that later. The next is the task icon. We've seen these before, but it looks a little bit different. This is going to be seen consistently across the entire application, so it won't, and some of the placement of the task icons might have changed in the system. The third icon is been reconfigured. This is the menu icon. You might remember in the past that there was a small triangle somewhere in this area, black triangle, really not indicative of what it was for, what it was meant to be used for. This is a list within a circle, so it's indicating that this is a menu. If you click on that menu, it gives you a list of options of things that can be done from this area. You can see they've also used this icon up here in the toolbar, and you'll see this menu wherever they've been using that small triangle or opening up menus in the past. The last thing that I wanted to cover over here is the addition of these three items. they've, in addition to having them at the bottom of the note authoring workspace, you can see that they've used save and close, and they've put them up here at the top. So there's no need to scroll to the bottom of the note if you need to save and close while you're up here. So it's hopefully improved function and saving you some time and steps of having to scroll to the bottom of the screen. All right, transitioning over here then to the table of contents part of the note authoring, you can see they have made some changes here. If we look at a form, and you can see we have like 5 different forms within the history of present illness. We now have the ability to reorder these forms once they're pulled into the note, giving you the ability to prioritize your list, moving the most important documentation for that visit up to the top. That is helpful with your billing, being able to prioritize the problems that you're looking at and making it more precise and easier to read for those people that are reading and reviewing your notes. So if we right-click on any one of these, you can see we have the ability to move the form up and move the form down within this note section. Okay, scrolling down farther in your table of contents in the results, let's see, vitals first. Here in the vitals section, they've added this icon, giving you the ability to select your vitals panel that you want to pull in. Again, making it a little bit easier. And then also, in addition to that, they've made some other changes to the vital section, but we aren't going to go into these in great detail in this webcast, but they've given us the ability to require vitals to be done, and this is important for meaningful use and for other quality initiatives within the EHR. But if you want more information about the changes to the vital section, there is a blog out on the Galen Wiki called TouchWorks 15.1 Vital Sign Enhancements. And so please take a look at that if you have questions on that enhancement. And then going down to the results data section, you can see here you had the ability to pull in advanced results citation, but quite frequently your results data list is long and it required you to scroll down to get to this area. Well, they've added this as an additional button here in this area to make it easier to get to your and to pull in additional results citations into your note. And then the last but not least, down here in the assessment section, if we highlight any one of these, and we're talking about primary hypertension here, they've given us the ability to easily add an impression to any particular problem that's listed, and you can see that it takes us right to the current impression section where you can quickly add comments or impressions and save those impressions to that problem and save that information to your note immediately without having to close your note and go out to the problem list and make that impression. And we'll come back to this again because you have the ability to use a text template in that area. And Catherine will talk about that. All right, now there's also been some additions to the medication sections, and it applies to 3 different medication sections: current meds, past meds, and also the end of encounter meds. So let's take a look at the end of encounter. You can see that they've added a couple new buttons here to the toolbar, med history and RX or medications. This gives you the ability to go out to these sections without ever leaving your note, without losing the place in your note, and add or make corrections to DC or to discontinue or make any changes to the medications. So it's a quick link directly out to the ACI where you can make any changes that you want to within this section. In addition to that, they've removed some items from this list at the bottom. They've taken out the print clinical summary, re-sign failed EPCS, void a failed EPCS, trying to clean this up. And they've also reordered it and made the things that you do the most easier to get to within the system. Then they've also made this section, this whole section bigger upon opening, just to make it easier to view the entire list. And then the last thing they did was they made this reconciliation button actionable. And I think this is long past due, something that we've really been looking forward to. Before, when you clicked on this reconcile button, it gave you a warning and said you had to go out to the medication component on the clinical desktop to make these changes. Well, now if you click on this reconcile button, it opens up a reconciliation screen, giving you the ability to make any changes. You can see that you can record DC, you can complete today, you can add and make changes, and then reconcile this button. Then it's also giving you the ability to do the same thing with allergies right from within this screen. So you can reconcile your allergy list and reconcile your medications right from here. Now, before I go on, there was one item I wanted to tell you about that I forgot, this complete on and complete today. They've changed the terminology with this. It used to say completed on and completed today. They've changed it to the present tense to make it more reflective of what you're actually doing during your care, during your note session and your visit with the patient today. Okay, and this can be seen everywhere in the application, whether you're working in the meds component or within the note. You're going to see the change in that terminology. So let's click on that reconcile button. You can see it changes to done here. And if we close out this box, you can see that it made that addition here in this section also. So again, this is something I think people have been wanting and needing for quite some time. So it's great that we've gone there. All right. Now, from the table of contents, I want to move down to the output templates. If we go in and we're going to view this one, if we open this up, there we go. We have the ability now to automatically print, fax, and invalidate from the toolbar. These have been added to the toolbar automatically. Just for ease of use, no need to right-click and, moving down on, or there's no need to right-click anymore, and you can quickly get to the section that you need and do your changes. Okay. So we're going to close out of here, and at this point, I'm going to go ahead and save and close this note because I want to go into the note admin section. So I'm going to change over here. Now this is all assuming that you have admin rights and you have the ability to make changes to the note. They have gone ahead and made some updates to this note admin section within the forms. If we go ahead and we sort, and let's do a sort here by HPI and take a look at this section and go ahead and sort using our search button. You can see that within this section they have made, again, some changes. These have not changes across here, but they've added a new column called linked inputs. If we sort by, this is a sortable filter so that you can see if we sort, these are the top items and these are the forms that have been linked to a note template. Many times when you're creating notes or doing maintenance on your notes and you're trying to figure out which of these abdominal pain forms you've used in which different type of note. Well, now this new function or new feature tells you exactly what template these have been attached to. Because quite frequently you can see we may have many different forms with the same name or very like names. Also with this, once you click on the link, it's actionable and opens up a table that tells you which document type it's been linked to, which specialties have access to that particular template, and the description that you've added in the section. So this is going to be very helpful when you're doing maintenance on notes and creating new note templates. Okay. Then also in here, I wanted to take a look at some changes in the note output. Oh, before I move on though, sorry. At the bottom here, they've given us the ability to print that list. I'll print a list of the different note forms. So let's say that you are working on some forms for family medicine. You have a new family medicine doctor starting, and you want to give him a list of all of the different note forms that you have worked and created and build out for that particular specialty. You can see we only have one in here, but if we want to print this out and give it to the users, give it to the providers for them to review, roll up here just a little bit, this helps you with obtaining end user buy-in and the ability to review the notes that you've already built and involve your staff in the build. So it gives them a list of exactly which forms that you've worked on that are available to that particular specialty and who it was that last created them, or who it was the one who modified those last. This becomes really important when you're building notes for a new specialty and for new providers, and again can help you with that user buy-in, being able to print and get that out. Let's cancel this. All right, now going down then in the note template, we want to take a look at the output section in note templates. So we need to search here and pull up some templates. Go ahead and choose this one. And when we open up this template, I want to, before in the past with the output templates, you haven't been able to reorder these. You had to open them up, edit, take them out, and move them back in the order that you wanted to create them. Well, now, if you right-click, you're able to move the form up or move the form down and able to actually go in and reorder those for the providers on the front end. In addition to that, they've made some changes in the output section, particularly in the med section. So if we take a look at the med section, they've given us the ability to further filter what will appear in the note output. So in the 3 medication sections, this applies to all the med sections. They've given us or added the ability to filter by med name, strength, and SIG only. And that is what would appear in your note output. So if you're building out a consult note that's being CC'd back to the provider, there's really no need in the current meds to give them all of the details and for the expanded details up here in the current meds. So you can go ahead and limit it to just meds, name, strength, and SIG only. But then in your end of encounter meds, you want to include more detail so that they can see why it was you ordered the med, when you're going to discontinue it, all of those expanded details, so you won't filter it here. So it's giving us the ability to make our notes more precise, easier to read, and again, making them particular to your provider for your organization. All right. So from here, we're going to move into the preferences. I told you we'd take a look at some preferences. There are 3 particular preferences that I want to take a look at. Click here. The first preference that I want to talk about is the ability to copy forward sections of the note. Can't find my scroll. And here at the bottom, got to change it to notes, sorry. The first one that I wanted to look at is the vNote copy forward previous history. And there are 3 choices that they've given us. But with the push to improve and make documentation more accurate for your CDI or clinical documentation improvement, or with ICD-10, many organizations are choosing to limit the ability to copy forward parts of the note. You can change these at the enterprise level. Previously, you had to go into each different note template and make the change there, the ability to copy forward in the different note forms. Well, now you can do it at a preference level, and it can be done at an org or an enterprise level. The first choice you have is disable copy forward previous. And what this does is it causes copy forward, previous exam, and previous history to be unavailable in the note authoring workspace. The second choice you have is allow copy forward previous. Again, those same 3 items, copy forward, previous exam, and previous history, are available and will copy forward regardless of whether you edited the form in a previous note. And the third choice is a limited copy forward, previous after the note form edit. So if the note form was edited, it will not copy forward, and you'll get a message that contains the uncopied form data, and it also lists the note section and name and the form name where the data is located, giving the provider a heads up that this information did not copy forward and that they need to re-enter that information. So again, this ability to limit copy forward hopefully is an improved function for your organization. The next area that I want to talk about is the default specialty, and this is the one we talked about earlier on setting your favorites in that note form selector. So it's default, note default. I'm sorry, there it is, right here. They've changed the name, and I guess that's why I couldn't find it. It used to say default specialty in form selector, and the name has been changed to default filter in form selector because they've actually changed the choices that you have. Again, they've given you the ability to create a favorites and then default that list in the form selector to your favorites. And then they've also, the other choice is the default note specialty. Previously in this section, you had the ability to filter by specialty instead of using your favorites. But now it defaults to whatever specialty you chose when you created that note. So it's the default note specialty, not a particular individual specialty, user favorites, or no default at all. And then the last one I want to talk about is an addition to how signatures can be displayed in the V11 note, and that the preference is called the Note Default Signature Display. And here what they've done is they've added the ability to include the license number of the provider in the V11 signature, V11 note signature. With the installation of 15.1, this signature display has been added already to the signature dictionary. So there's no configuration as far as the dictionary goes. It's a simple preference change. pulling that information into the signature based on this preference setting. Those state license numbers and the credentials pull from the TWAdmin section. So when you build your providers and you add their license date, and updates to this section will also automatically pull into here because it's pulled from that section. No need to go in and make changes as things, their credentials might change, the dates might change in your TW user admin. It will automatically pull into their signature. So it's not a hard configuration, it's just a preference setting to get that up and running within your system. All right, so here we're going to change over into Note Admin in this section. So give me a minute here. We got to go back up to Note Admin and in Forms. And we're going to clean out some of these filters because we're going to talk a little bit about some changes in EHR. So just a minute here, make this procedures. Do you want to get a drink or stretch a minute? All right. Okay, let's go ahead and open this form. Okay, if you'll come back here, we're going to start again. In the charge, I want to just take a minute to talk about charge from the note authoring workspace, another new feature with 15.1. We have been there, we want to show you that they have put some new functionality in the charge module, and this is how it applies to the V11 note. There are additional charge enhancements in the charge module that are really beyond the scope of this webcast, and you can see those again. There's a blog out there about this one too, the TouchWorks 15.1 charge module enhancements that you can view to see all of the different changes. But as far as the V11 note goes, they've made some changes so that when you document clinical services in the V11 note authoring workspace, you can now select charge codes to associate to the documentation right in that note form. The charges are automatically filed to the charge summary from the note, and then you only need to submit the charges from the charge workspace. You can see here on this note form that I've pulled up, these $ will appear in your note authoring workspace indicating that a charge has been linked to this particular item in your note forms. Okay. If we look at how these are put together, I'm just going to show you quickly how you would attach a charge to this particular item. This can be done to existing notes in addition to doing this with any new notes you built, but you need to identify which charge code you want to attach to this particular control or item within your note. This is a good way to help your providers know which are the best choices as far as charging goes. There are many different types of charges for EKGs, and you want them to use this particular charge. That's the one that you have built in your charge function in your practice management. So this is a good way to educate them and to quickly tell them this is the charge code that we want you to use. So down here you can see this charge links give them the ability to link it to a single group, a single charge, or to allow them a master search so that they can choose that charge link. If you choose the single charge, then you have the ability to go into this charge code area and select exactly what charge code you want to use. So if we click on this link, you can see you can search by name, you can search by charge code, and bring that information into this and link it directly so that every time they choose that EKG in this section, it will automatically link it to that charge. On the Doppler color flow, I went ahead and built this one as a master search so that on the front end I can show you what this looks like with the charge link being with the master search. So I'm going to try this real quickly up in the debug section to see if I can show this to you. If we choose the color Doppler, you can see it opens a charge code selector where you can quickly find and search for the color flow that they want to use. This isn't the right one, but if it came up, they found what they needed, and you could quickly go ahead and link that. Okay, so that isn't going to work in the test system, but that's how this charge module, charge enhancement actually works. So these dollar signs are indicating that there is a charge attached to those forms. Again, there's more information out if you're interested in that. So we're going to close out of this one because I want to go in and now talk about recommended orders and required items. So we're going to go into a different note form here. We're going to go back up to HPI. Well, it doesn't want to let me search that way. Okay. All right. The 15.1, the upgrade, has given us the ability to make certain orders or certain items within your note form required. And I see this as one of the most useful and exciting new functions with 15.1. It gives us the ability to build education points and care guide-like information right into the note form. These items are then actionable and can be captured in reports and analytics for quality-based initiatives. This does require some configuration, and we're going to go ahead and show you the configuration on the back end and then show you the function on the front end also. These items that are in yellow have already been configured as required items. They use the same yellow coloring here as they do other places within the EHR, indicating that these items are required. And what happens is if the provider sees that these are required, it's necessary to choose or to choose any one of these particular controls and indicate something in this type area in order to fulfill the requirement and have it done. So we have the ability to make an individual item required. So let's say we just wanted to require them to indicate something as far as stroke goes. In the configuration, you have the ability to make this particular item required. So you can see here the required field. All you have to do excuse me, all you have to do is check mark this box and you can see this automatically turns yellow and it is now required. Once it's required, if the provider does not indicate something for this particular item, he cannot save or finalize his note. He can save and close his note, he just cannot finalize it and finish out his note until he has fulfilled this requirement. In addition to making an individual item required, you can create a group. So if you're telling your provider that for hypertension, in this note you need to tell me, do they have any comorbid illness, either no, they have none, or they're going to free text and type an area in, or choose one of these that we've given in the list. So we can go ahead and use our lasso item, if I can get this to choose all of these at once, and create a group. This is similar to when you create other groups, but what you're telling them in this group, if we make these all required fields, and it takes just a minute to turn them all yellow, once they click any one of these required items within this group, it satisfies the requirement for the entire group. So all they have to do is say they don't have any comorbid illnesses. It would make this entire group then no longer required because you've answered it. So what you have to do then is create your required group name. So we'll call this comorbid. And now all of these items are linked together. And once you satisfy one, it satisfies all. You can use this required feature on yes, no controls, plus, minus controls, check boxes, radio boxes, and text fields. So it works for all of those different areas. And we'll show you on the front end then what this looks like and how this whole, the required actually works within the system. But before we do that, I want to talk a little bit about required orders. Now these were required items. And well, I didn't save it, but that's okay. We have others. In addition to that, in addition to making required items, we can make recommended or required orders in a note. In your note templates, if we look down here, there is a new section that's been added. It's called Recommended Orders. This new section has automatically been added to the section dictionary, so there's no configuration as far as the dictionary is required. This will appear, and all you have to do then is insert this Recommended Orders section into an existing note template or a new note template that you're building. But to use this new function, it has to be, you can only put recommended orders into this particular note section because it has some different functionality than the other sections that you've put into your note. So once you've inserted this recommended orders, we're going to go ahead then and show you how to create an actual recommended orders note form that you can pull into this section. So we're going to switch back over to the forms area, and we're going to create a new note form. And in this, again, you're going to create your form, but it has to be, the form type needs to be a recommended orders in order for this function to work correctly. You're going to go ahead and create all of this information for this note form based on your naming conventions that you use in your facility. So our description, you can add it to a particular specialty and then create your form name. Oh, it's supposed to be 15.1. And then in addition to that, you have the ability to default a problem so that any order that you create in this section will automatically be linked to a particular problem. And it's easier to understand this when we look at it on the front end, but you do have the ability to default it to a particular problem or to create a list of recommended problems that they can choose from. Again, this ability to train the providers to use the correct diagnosis for a particular problem so that it can be billed and coded correctly, or to give them a list so that they can choose what diagnosis they want to link it to. And again, I'll show you a little bit about that on the front end. Once you click OK, it brings you automatically to this note form builder for these recommended orders. And you can see over here, this looks a little bit different. The only choice you have when creating this note form is to pull in orderable items. If we click on that and go ahead and create our control, it automatically opens a screen that allows you to select orderable items, and these pull directly from your OID dictionary, your orderable item dictionary. So you can search for, so for this hypertension, we're recommending that the best orders to be used for this and the best procedures that we want to pull in, we want to recommend a CBC be ordered for these different particular patients. And in addition to the CBC, we want to pull in a lipid panel. So you simply search, and again, these are pulled directly from your orderable item dictionary. So any item that you have built would be available for this build. And now you can see that these two items have been pulled into this note form. At this point, these items are not required. They are simply recommended. They aren't yellow. So you're making a recommendation to your provider similar to a care guide. These are the best items to choose for this particular problem. You have the ability to make them required in the same way that you do any other that we looked at before. You can make these required fields, or you can make them a group so that they have to choose either one or the other in order to fulfill their requirement. But I want to warn you, there's a word of caution here. If you define an order to be required, the control must be selected, or one of the controls must be selected in the note authoring workspace in order to make the note final. You might not want to define order controls as required if it doesn't need to be placed for every patient visit. If an order is required and the provider doesn't want to place that order, they'd have to go to the selected order, they'd have to go and select the order, finalize the note, and then manually remove it by canceling it or permanently deferring. And I don't know of any provider that would want to go through all those different steps. So you want to be very careful when you make an order required. There are some few examples of when you might want to do this, and one of them would be like a pre-employment exam. So all pre-employment prospective employees must have a urine drug screen or a drug level drawn during this exam. So you could make those two items required, and then the provider would have to order those before he finalized his note. So that would be one area, one time that you could actually make these required. All right. So we're going to go ahead, close this out. And then we're going to go on into the front end and actually look at how this looks on the front side. And you saw some of this when we were in the note earlier. But again, these items are going to appear in yellow. You can see even in the table of contents, it's indicating that this particular form has some required items in it, and so does this form, so that they have to be addressed before he can actually move on and finalize his note. So since I didn't save the one that I made the changes, this is not required. This is a previous note that I had built. But simply by clicking one of these items and saying that this is the follow-up form that I'm using for essential hypertension, you can see that this is no longer yellow and this is no longer yellow, indicating that it has been fulfilled. This requirement has been fulfilled. In our recommended orders, on these two, I did make them required in addition to being recommended. So you can see that these two items are part of a group and are required now, but they could be just recommended. But once you order one of these items, since these two items are automatically linked to primary hypertension attention because we selected that as an established, or as a, I'm sorry, we've already indicated that these are an assessed problem. It's linking them. But remember when we said in the build process, you could default it to a particular area or particular problem, or you could default it to a list or a group. So I've created a list here, so these are recommended linkage to the particular problems, or you could default it to a particular problem, and this is where this list would show up. So we're going to go ahead and complete these so they're no longer required. Actually, I'm going to take it off, because if the provider then tries to sign this note at this point with these still in yellow and have not been fulfilled, and I try and sign this, I get a warning that tells me that there are required items that have not been completed, so he cannot sign this note until this is taken care of. And again, allowing, once that's been completed, he can go ahead and sign and finalize his note. Okay. All right. So that, again, completes my part of the section, and I'm going to turn the controls now over to Catherine, and she's going to talk a little bit about note output progress checks, text macros, and text templates.
Thank you, Ellen. Hello, everyone.
You're welcome.
The first item I'd like to talk about is the note output progress check, as Ellen said. This is new functionality that can assist providers with provider education and documentation improvement, but it's optional and it's for informational purposes only. It does not prevent the note from being finalized. The progress check can be ran while in the note authoring workspace or in the note output summary screen, and it will indicate if required items have been met. The configuration is done in the note output template, and we're going to look at that. There's a new checkbox there that's now available in each section of the note output template except for the signature section. The box is called Participate in Progress Check. The progress check is used to help determine if a minimum level of documentation has been recorded for specific note outputs. You can set all sections to participate if you want by checking that box in the format defaults for all sections. So we're going to go take a look at that configuration now. Again, a user will require to have admin privileges. We'll navigate to our TW admin space, click on your note admin, and then you click on the note template tab. This can be done on an existing note template or on a new template as well. So I'm going to go to my initial. So in the bottom left corner, you'll right-click on the output template and click Edit, and your note output template will open. And as I said, you have the format defaults for all sections, and you see that all sections participate in progress check boxes there. You could simply check that if you wanted all sections, which would probably be unlikely. So otherwise, you would just uncheck them all and then come over and just check the certain sections that you want to participate. And once you've checked all your sections, you'll simply say OK and save your template. That setup is pretty easy. The next thing you'll want to determine is if you want to set the note output progress warning timing preference. To do that, you'll navigate over to your preferences. Go into note, note. And right here you have note output progress check warning timing. So there's 4 options for this timing. Never is the first one. If set to never, the user will not receive a warning to notify there are sections that failed the note output progress check at all. If it's set to on closing, this setting will provide the warning box when a user tries to save and close a note, sign, or finalize a note. If it's set to on signing, this setting will provide the warning box when a user tries to sign or finalize the note. And then the last setting, on finalization, will provide the warning box when a user tries to finalize the note. So for today, I'm going to set it to on closing. I'm going to save that. So now let's go take a look at what that looks like. Open a note on my patient. So if the physician starts documenting in his note, and then he stops because his next patient is here. So if I go ahead and stop because the next patient's there and I click my save and close, okay, so I apologize, I chose the wrong note, so let's go look at this note so I can show you that warning box. So if I say save and close, you'll see that I get the warning box now. And I can choose to say okay and continue on, or I could cancel and it would let me go ahead and save and close my note. But I'm going to say okay. So you can see that your note output progress check box will open up, and you can see the sections that have passed the progress check. And then down at the bottom, you see the red unhappy face tells me that that discussion summary section has not passed. The NA, of course, means that those sections don't participate in the progress check. So at this point, I can close the note, and I could go back to that section, and I could complete the section that's not finished, or like I said, if I say save and close, I could cancel, and it would let me save and close the note, and I could get back there again at another time. And as I told you before, if the user's preference is set to never, they won't get that warning box. However, they could do a progress check if they wanted to while they were working in their note, just to get an idea of where they were at. And to do that, they would just simply right-click on the output, and then they would have the progress check button. And they would be able to open the box and see where they're at. They could also do this in the Output Summary View tab. So if you click the View tab, on that tab that you set up, you'll see at the bottom now there's a progress check button. So they could just click that, and it will, again, bring up that warning box, or that progress check box. So next, I'd like to go ahead and close this note and then move on to our text templates. Okay. Oh, I'm sorry, I should have left that note open. So the text templates, as Ellen said, this is a great new feature, and I think it's one that people will really enjoy. They can be managed in many different areas. So if we look at the chart at the note authoring workspace, you can see, as she pointed out, that the text template icon is here. I also want to show you where we can look at this in the different areas of the application. So we go out to our chart viewer. From your clinical desktop, I'm sorry, my screen is missing its sizing. Let me try and fix this. So from your clinical desktop, you can see that main menu button
Okay, so from the note.
Okay, I apologize. I said text templates and I meant to say text macros. So we'll start with the text macros. So the text macros can be managed in many different areas. And as she said here, you can see the icon here. I'm just going to close the note so that I can show you the different areas in the application. On the clinical desktop, over on that main menu icon, you have the Manage Macros. Also, when you're in the daily schedule, and you have your clinical toolbar open, you have that main menu icon there and your Manage Macros. You can also manage macros from within a task. So, and not from within the task screen, but if you were to create a new task or reply to a task, you would have that Manage Macros icon up in the top. You can also manage the macros from the call processing screen. That's also going to be up in the right-hand corner. So let's go back into the note and look at it from within a note. So when you want to create your new macro, you can just simply click your icon. Your Manage Macros box is going to open up, and you have the option. You'll see what you've already have created for your personal macros. You can also click this checkbox to include any enterprise macros that are available, and you can see those. You could also create, edit, and copy your macros from here, or you could inactivate those macros. So to create the macro, you just click that Create button. The shortcut name will be yellow, so an automatic field. You can see that it already has the period, so you just have to put the name of your macro. So I'm just going to name this test macro. And put your short description in. And then you would come down here and type all of the information that you want for your macro. You also have the ability to use your merge fields if you want to include any merge fields within your macros. Over here on the right-hand side, you can see all of them that are available if you wanted to use those. It has the spell check, and you can verify your merge fields. Once you've entered the information, you simply click Save. Oh, and it's telling me this is already in use, so I'm just going to stick a 1 in front of it. Click Save and Close. So then you would just simply go to the section where you want to insert that macro, and you would just type in or dictate in your macro, hit your Enter key, and it'll insert your macro information. So you can also work on these macros in the PhysAdmin workspace. So let's go ahead and look at that. Close this note. So we'll want to navigate over to our PhysAdmin workspace. And you'll click on Module, then Note, and then you see you have a Manage Macros tab. So a user with admin privileges can create, edit, copy, activate, and inactivate an organization's text macros. They can also assign macros to individual users, copy macros, and track macro usage and last date used. You can see the modified date, what was modified by, and here is your total usage and your last usage date. And it would be the same thing. They could either highlight these and edit those, copy those, and activate them. They can create new ones. They could create it at the enterprise level or simply at a user level. Same steps. Okay. Last, I'd like to look at text templates. The ability to create text templates is not new. However, as Ellen stated earlier, you're now able to add text templates into a note by clicking the Add Text Template icon. You can add a text template in any section by clicking on the section header and clicking the text template icon. If you click on a note form within a section, let's navigate over there. Open our note back up. So by clicking on my HPI section, I can click my text template, and it will put it at the top of that section. I could also put that in between any of the note forms if I wanted to. So if I click my hypertension and I click text template, you'll see that that is now going to appear. It's between the hypertension and the hypertension initial. Also, they've have added the ability to create favorites when searching for and selecting text templates. You can see that there on this screen there are, for the HPI section, there are 3 text templates available. It defaults to the specialty ID. One thing to note about this specialty ID is this is not pulling from the TW user admin space. It's pulling from the preferences, and I'll show you that preference. So I have these 3 here, and you'll see this blue star. The blue star indicates that this is a favorite, that I have made a favorite. So to make a text template a favorite, you just would click on your magnifying glass, and you can see that for the HPI section, any of the text templates that are available. So I could check them all as favorites or just another one as a favorite, say okay. And then if I come up here to my favorites, it'll refresh it, and you'll now see I have those 2 favorites. If I wanted to, I could go down to the orthopedics, and I can see any text templates that are available there. The other thing that is new is that you have the availability to, when you're in the assessment and you have a problem, if you highlight your problem, you can see where Ellen showed you the impression box. If you go into the details of that problem, you also have the ability to add your text template in there. You can continue to type or do your dictation if you wanted to, or you could pull in a text template. And it will show you for that specialty, again, any text templates that are available. It does not allow you to create favorites here, however. But you have all your different specialties, and you also have what's called blank specialty. So it will show any items that are available that don't have a specialty assigned to those. Okay, so now I'd like to go and show you that specialty ID preference that I talked about. Navigate back over to our preferences. And this is going to be under General. And I'm going to set this at the user level. So you have this default specialty ID, and this is where that will pull from. So whatever specialty you want it to be for that particular provider, you would want to come and set it here. So it would pull in appropriately into those text templates. Next, I'd like to go over to Note Admin. And I'd like to show you a couple of options for text templates in note forms. So you have the ability to add a text template to a note form. So what you would do is just click on your text template box, and then of course it brings you the field. If you go ahead and enter it, it will open it up, and you would pick whichever text template you want to use, say okay, and then you can see you have your text template box here. They've added the ability now to pull in the V11 text templates or the V10. So selecting the V11 text template ensures that when you load the current note form in the note authoring workspace, V11 text templates and filters are displayed based on the selected specialty. If you change it to V10 templates, this ensures that only V10 text templates and filters are displayed in the note authoring workspace based on the group selected. And you can see that that changes when I changed it from V10 to V11. It includes blank specialty and text template list. You select this to automatically include text templates that are not associated within a specific specialty or group in the list available, the text templates in the note authoring workspace. The last thing I'd like to show you is that impression text template and where that gets created. Again, it's under PhysAdmin by module, note, and then you have text templates. So, and when this text template box opens, you would simply hit this drop down and you want to click your WF impression. And then you have some already that exist. You could highlight one and copy it, or you could create a new one by clicking on the new button. You would just enter your name and your description. And then you can come down here and put any of the information that you want in. You can also insert your blank fields, same functionality as before. The one thing I'll show you is if you do want to add a specialty, when you click here, you would want to change this to whichever specialty. And then you would click now new, and it would bring that specialty in. And that's the impression text template. So that completes our review of the 15.1 changes to the V11 note. Please watch for a future 15.1 collaborative client optimization webcast from Galen. And for additional assistance with note configuration changes, more about charge configuration and any other Galen service or products, please contact us via our website. Thank you.